Today I'll discuss about the blood supply of the large intestine. The blood supply of the large intestine comes mostly from the branches of the superior mesenteric artery and inferior mesenteric artery. Superior mesenteric artery and inferior mesenteric artery, these two are ventral branches of the abdominal aorta. Superior mesenteric artery supplies all the structures which are derived from the midgut. Inferior mesenteric artery supplies all the structures which are derived from the hindgut. Let's start with superior mesenteric artery. Superior mesenteric artery supplies cecum and appendix via the ileocolic artery. There is a branch of the superior mesenteric artery. Superior mesenteric artery supplies ascending colon via the right colic artery. There is a branch of the superior mesenteric artery. Proximal 2/3 of the transverse colon via the middle colic branch of the superior mesenteric artery. So we have branches of superior colic artery, ileocolic artery, right colic artery, middle colic artery. They supplies large intestine which are derived from the midgut. So here we are looking at the large intestine. Here is the vermiform appendix or appendix, cecum, ascending colon, transverse colon, descending colon, sigmoid colon, rectum, anal canal. This part, rectum, anal canal, lower part will get contribution from the internal iliac artery via the middle rectal artery, and from the internal pudendal artery via the inferior rectal artery. Otherwise, entire large intestine is supplied by the branches of the superior mesenteric artery and inferior mesenteric artery. Superior mesenteric artery supplies up to this level. And this part, the splenic flexure, descending colon, sigmoid colon, rectum, this part, also upper part of the anal canal, this part is supplied by the branches of the inferior mesenteric artery. So this artery made some arcade here. We are seeing some arcade of blood vessel. Then we're getting vasa recta, straight artery entering the wall of the intestine. Okay, these are the vasa recta. We have also here marginal artery here at the splenic flexure. And we have also vascular arcades. We have seen vascular arcade here, vascular arcade. This is another vascular arcade, and we'll get the vasa recta from the arcade eventually. So this is large intestine. We're looking at tinea coli here. We should have 3 tinea coli. One is posteromedial, another is posterolateral. We are seeing this one. And we got the blood supply. This is superior mesenteric artery. This is a branch of the abdominal aorta. This inferior mesenteric artery, that is also a branch. Mesenteric artery is also a ventral branch. This is for the hindgut derivative, superior mesenteric artery for the midgut derivative. And this is the abdominal aorta, superior mesenteric artery, inferior mesenteric artery. Okay. Superior mesenteric artery passes over the third part of the duodenum. Also, we'll see in our another picture, it also passes over the left renal vein. Okay, we got that. Now we'll go to the blood supply of the large intestine, continued. Okay, inferior mesenteric artery supplies the distal third of the transverse colon, descending colon, sigmoid colon by these branches like left colic artery, okay, and sigmoid artery. These are branches of the inferior mesenteric artery. The rectum and anal canal are supplied by the superior rectal artery, that is a branch of the inferior mesenteric artery. Middle rectal artery contribute on the outer wall of the rectum and anal canal, upper part of the anal canal. This is a branch of internal iliac artery. Inferior rectal artery, that is a branch of internal pudendal artery. Okay, that also contribute in the blood supply of the rectum and anal canal. And median sacral artery supplies a small part on the posterior aspect of the rectum going to the anorectal junction. Mesenteric artery is a branch of the abdominal aorta, dorsal branch. It is just above the bifurcation of the abdominal aorta into common iliac arteries. Okay, we got that. Now we'll go to the venous drainage of the large intestine. That is very important also, like arterial supply. Superior mesenteric vein drains the area supplied by the superior mesenteric artery. Inferior mesenteric vein drains the area supplied by the inferior mesenteric artery. These veins ultimately drain into the portal vein. Portal vein is formed by the union of the superior mesenteric vein and splenic vein, and inferior mesenteric vein usually opens into the splenic vein. So these veins ultimately going to the portal vein, which then carries blood to the liver at the porta hepatis and end up in the liver for detoxification before returning to systemic circulation. Okay, we got that. Systemic circulation from the liver will getting the hepatic vein going to the inferior vena cava. So this is the superior mesenteric vein passing over the third part of the duodenum. This is the superior mesenteric vein. This is the inferior mesenteric vein. Superior mesenteric vein unite with that of the splenic vein to form the portal vein that enters the porta hepatis, and blood goes to the liver for detoxification. And inferior mesenteric vein is this drain blood from the part of the large intestine which is derived from the hindgut. Superior mesenteric vein drain blood from the part of the large intestine which is derived from the midgut. Okay, we got that. We just discussed that the superior mesenteric artery, that is a branch of the abdominal aorta, ventral branch, supplies the derivatives of the midgut. It crosses the left renal vein and third part of the duodenum. Okay, so here it is. We are getting again the venous drainage, superior mesenteric vein. Okay, here is the inferior mesenteric vein. Superior mesenteric vein unite with the splenic vein to form the portal vein that goes to the liver. Splenic vein usually receives the inferior mesenteric vein. Clinical anatomy of the blood supply of the large intestine. If our mesenteric artery undergoes atherosclerosis, we might have ischemic colitis. Our large intestine will be lacking blood flow and may be damaged due to ischemia. Selective surgical colectomy surgeon do depending on the location of the cancer. Surgeon take out that particular part of the large intestine which is fed by a particular branch of a mesenteric artery. So the distribution of branches of the mesenteric artery to a particular tumor in the colon, surgeon can take decision how far he can take out part of the colon. Spread of cancer through the large intestinal veins, tumor metastasis, particularly by the mesenteric vein, goes to the portal vein, and the cancer cell or tumor cell is usually, this is the malignant tumor cell, will go to the liver, and we know that liver is a common site of metastasis. Inferior mesenteric artery blockade due to aortic aneurysm. Aortic aneurysm may happen any part of the aorta, but a common site is between the bifurcation of the aorta and the renal artery. In between them, there is aortic aneurysm, that is the abnormal dilatation of the aorta that involve the origin of the inferior mesenteric artery. Inferior mesenteric artery may be kinked, its lumen may be obliterated by the ballooning of the aorta. So in that condition, the hindgut structure like that of the descending colon, sigmoid colon, rectum may be devoid of blood flow. They go through ischemic changes. Ischemia in the watershed area where one artery and another artery begin, like at the splenic flexure and also rectosigmoid junction. These are called watershed area. Here, one artery and the star artery begin like in the splenic flexure. The the superior mesenteric artery and the inferior mesenteric artery begins like the rectosigmoid junction, the inferior mesenteric and will get contribution from below from the internal iliac artery. Vasa recta, as I mentioned, these are straight blood vessel going to the wall of the large intestine, and that area is weak area. Through this weakness, there may be extension of the mucosa, submucosa. We call it diverticulosis. Very much common as the age advances, and particularly common in the sigmoid colon. Possible obstruction of the third part of the duodenum and left renal vein. And that's all about the blood supply of the large intestine, that is the colon mostly. And if you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me and have a nice, wonderful, and blessed day. Bye now.